Hi, welcome to this brief presentation on sterile IV insertion. This presentation is brought to you by Lubabaro Kuzana, Promise Moveni, and Lungani Masamani in association with the UCT Orthopedics Department. The indications for sterile IV would be an immunocompromised patient, in which case you don't want to introduce any new infections in their system. This also includes patients that are in intensive care use. Such patients actually include patients that have acute spinal cord injuries. This means that the patient has lost neurological function distal to the site of the injury. This may also affect the integrity of the immune system, which means that they are more susceptible to infection now. And this is the reason why acute spinal cord injury patients need a sterile procedure when inserting IV rather than compared to other patients. This is to prevent any bacteremia or septicemia that might occur. The more common indications for an IV line include resuscitation. This would be in any emergency situation or trauma center. There's also retreat maintenance for the patients that are around your ward, and there's also replacement of fluids in a patient, a burns victim, or any other patient that has happened to lose a lot of it. There are numerous types of IVs, but for the purpose of this video, we're only looking at peripheral IV insertion. The first part is the introduction. This is when you greet and you introduce yourself to the patient. Confirm that you have the right patient. Then from there, you explain what you're going to do and why you're going to do it. And this is the point where you get verbal consent. At this point, you would wash your hands and get your equipment ready. You will need a tourniquet, chlorhexidine, you will need a sterile pack, sterile gloves, offsite, your IV giving set, and you also need your IV cannula. At this point, you would get your sterile pack. Open your sterile pack in order to remove your sterile field. At this point, be sure not to contaminate your sterile field. Next, you will open all your sterile equipment onto your sterile field. You can open them in any order that you wish. In our video, we open our sterile gloves first, the offsite, and then lastly, we open the IV. Be sure not to forget your cleaning solution. In this case, we use chlorhexidine as our cleaning solution. Pour the chlorhexidine onto the swabs or gauze that is in your sterile pack. Next step will be to put on your tourniquet above the antecubital fossa. This tourniquet will help you visualize a nice vein in the fossa as a point of insertion. Next, clean your hands and get ready to put on your sterile gloves. Open your gloves onto your sterile field, making sure not to contaminate them. When you're done putting on your gloves, this is when you pick up your cleaning swab or your cleaning gauze. Then proceed to clean your site of infection. When you're cleaning, try to go in circular motions, going outside from the point of insertion. Make sure while you're cleaning, you are very generous and clean a broad area to ensure that the whole area is actually free from any germs. Next, you prepare your sterile window. This will help you get a good visual on your site of insertion, but it will also decrease any chances of contamination from the area surrounding your antecubital fossa. Next, get your cannula ready. Make sure that your cannula is actually loose from the needle. You want to insert the needle at an angle of 25 to 35 degrees to the skin. When you actually inside the skin, you should see a flashback of blood in the cannula. That will confirm that you are in the vein. Now try to advance your cannula sheath into the vein. Make sure you put pressure on the vein in order to secure the cannula and also to minimize any bleeding. Try to remove the needle safely. Most needles should have a safety mechanism for this, at which point you would discard your needle into your shop bin. You should now quickly insert the bottom end of the drip. When this is done, you will need to secure your cannula using a transparent offside. And that is how you insert the sterile IV. Be sure to thank your patient afterwards and clean up after yourself. The IV should be checked daily. Check if the IV is still running. Check if the dressing is still intact. And lastly, check for any signs of infection.